Hey there. In this video, we are going to talk about genetically modified organisms and their impact on agriculture and health. The debate surrounding genetically modified organisms, or GMOs, has been ongoing for several years now. These organisms are created through genetic engineering, with the aim of improving crop yield and resistance to pests and diseases. However, there are concerns about the long-term impact of GMOs on agriculture and human health. In this video, we will explore the pros and cons of GMOs and their impact on agriculture and health. First, let us look at the history of GMOs. The first genetically modified plant was created in the early 1980s, and since then, genetically modified crops have become increasingly popular. Today, GM crops are grown in over 30 countries, with the majority being in the United States, Brazil, Argentina, India, and Canada. These crops are engineered to produce higher yields, resist pests, diseases, and environmental stress, and improve their nutritional content. One of the most significant advantages of GMOs is their potential to increase crop yields. By engineering crops to be more resistant to pests and diseases, farmers can reduce the use of pesticide and herbicides, leading to lower production costs and higher yields. This can help alleviate food shortages in developing countries and increase the overall food supply. GMOs also have the potential to improve the nutritional content of crops. For example, scientists have developed a genetically modified strain of rice that contains higher levels of vitamin A, which can help combat vitamin A deficiency, a leading cause of blindness in children in developing countries. However, there are also concerns about the long-term impact of GMOs on agriculture and health. One of the main criticisms of GMOs is that they could have unintended consequences for the environment. For example, the widespread use of genetically modified crops could lead to the development of herbicide-resistant weeds, leading to increased herbicide use and environmental damage. Another concern is that the use of GMOs could lead to a loss of biodiversity. By engineering crops to be more resistant to pests and diseases, farmers may rely on a limited number of crop varieties, leading to a reduction in genetic diversity. This can make crops more vulnerable to pests and diseases, as well as reduce their adaptability to changing environmental conditions. There are also concerns about the potential health risks of GMOs. While there is currently no evidence to suggest that GMOs are harmful to human health, some studies have suggested that they could have unintended consequences. For example, there is some evidence to suggest that genetically modified crops could be allergenic or toxic to humans. Another concern is that GMOs could lead to the development of antibiotic-resistant bacteria. Some genetically modified crops are engineered to produce antibiotics, which could lead to the development of antibiotic-resistant bacteria if these crops are consumed over long periods. Despite these concerns, GMOs have the potential to revolutionize agriculture and improve food security. However, it is essential that we continue to study the long-term impact of GMOs on agriculture and human health, and that we take steps to mitigate any potential risks. In conclusion, GMOs have the potential to revolutionize agriculture and improve food security. By engineering crops to be more resistant to pests and diseases, farmers can reduce the use of pesticide and herbicides, leading to lower production costs and higher yields. However, there are concerns about the long-term impact of GMOs on agriculture and health, including the potential loss of biodiversity, the development of herbicide-resistant weeds, and the potential health risks of consuming genetically modified crops. As such, it is essential that we continue to study the long-term impact of GMOs and take steps to mitigate any potential risks. Thanks for watching.